Back pain is one of the most common of all physical complaints in the world. Muscles are used for three basic functions. The main function of the discs is to act as shock absorbers. The sciatic nerve is the longest and thickest nerve in the human body. Welcome to Vardhan Ayurveda YouTube channel. Today we will be talking about the common complaint, the back pain, and its three sources. Back pain is one of the most common of all physical complaints in the world. More than 90% of men and women in India have had or will have at least one bout of incapacitating low back pain. It contributes to lost work time and can become a lifelong struggle if not treated properly at a correct time. The simplest tasks of everyday life, like performing a simple turn, twist, lift, and either push or pull something the wrong way, can cause low back pain that becomes constant and debilitating in nature, and in due course will make you crippled with it. Three sources of back pain. Number one, muscular inflammation from repeated muscular spasms. Number two, pressure from bulging, ruptured, or herniated discs. And number three, sciatic nerve damage that sends shooting pain down the legs. Let's talk about them now. Number one, muscular inflammation. Muscles are used for three basic functions. Number one, support. Number two, movement. And number three, posture control. If muscles are tight or weak, they create or worsen back pain. Joints are controlled by at least two sets of muscles: flexors, which bend the joint, and extensors, which straighten it. In addition, most joints have rotator muscles that twist and rotate your bones. Good posture is only possible if the flexors, extensors, and rotators are in proper balance. Paraspinal muscles, these are the muscles which run parallel to the spine. They rotate the spine, bend it backwards and sideways, and influence posture by creating and maintaining the curves of the spine. Erector spinal muscles are involved in movement and run the length of the spine. They help to bend over by resisting the force of gravity and to straighten up by contracting and exerting great comprehensive force on the spine. Abdominal muscles, they play an important role in helping to support the spine by maintaining pressure inside the abdomen, which is an essential measure of counter support to the spine. Any inflammation of these muscles will thus hamper the basic functions of spinal support, spinal movement, and postural control. Number two, pressure from bulging and ruptured or herniated discs. Disc in the spine is the spongy material that separates the vertebrae, allowing the nerves to run between each bone segment. The main function of the discs is to act as shock absorbers, provide separation between each vertebrae, and allow the spine to flex. The outer layers of the discs are formed from tough cartilage, which is called annulus fibrosus, and the inner core of the disc is a jelly-like nucleus called nucleus pulposus. A bulging disc, ruptured or herniated disc in the back occurs when all or part of the soft gelatinous central part of the vertebral disc is forced through the bones of the spinal column, and as a result, the outer ring tears or breaks, allowing the jelly-like material to poke through the crack. The disc bulge rupture can result in pressure on the nerves, often causing pain and sometimes leading to sciatica and leg pain. The intensity of the low back pain as a result of disc problem can range from a dull, intermittent, nagging ache to an unbearable, tear-eliciting pain. Number three, sciatic nerve damage. The sciatic nerve is the longest and thickest nerve in the human body, measuring just less than 1 inch, that is 2.54 centimeter in width, comparative to the diameter of a finger. The sciatic nerve begins in the lumbosacral region, that is L3, L4 through S3 of the spine, as 5 nerve roots from L4 through S3 leave the spine and merge into a one large nerve that travels across the buttocks, these are gluteal muscles, and down the back of the thigh and then into the lower leg, as pudendal nerve branching off just above the knee at the back of the lower thigh into the peroneal nerve and tibial nerves, and finally giving rise to nerves traveling down into the ankle, feet, and toes. Sciatic nerve transmits signals to and from the muscles and the brain. All movement and feeling in the legs and feet are dependent on the proper functioning of this nerve and its branches. When the nerve becomes inflamed, pinched, or injured, the symptoms result into sciatica, causing acute pain anywhere from the lower back and hips to the ankle, feet, and the toes. Sometimes it can become pressed, compressed, or crushed because of herniated discs in the lower spine, can result in a loss of movement, loss of sensation or reflexes, tingling sensation, numbness, and or weakness in the hip, thigh, legs, knee, calf muscles, ankle, feet, and toes. Let's understand the real reason behind the pain in the back. Vata, as told in Ayurveda as Va Gati Gandhanayo Vatam, is the real reason behind the pain and the painful mechanism, mainly lower back pain. It is the disruption of Vata at a level of musculoskeletal system and nervous system, that is, at the level of muscles, ligaments, tendons, discs, and joints and nerves. Vata gets disrupted by Dhatukshayam and Margavarodham and thus causes 42 different kinds of lakshanas. If back pain is neglected, it may lead and cause 80 different Vata rogas. Ayurveda, one and only treatment for spinal ailments. Ayurveda and we, especially at Vardhan Ayurveda Hospital, understands your spine in totality, that is, structurally, functionally, and spiritually. Hence, we are able to offer specialized treatments to treat the spine. Meru Chikitsa, ancient Ayurveda spine and neurotherapy, Marma Chikitsa, if practiced with Panchakarma Chikitsa, will eliminate muscular inflammation, pressure from the disc bulge and rupture, and heal the sciatic nerve damage from the grassroots level. The treatments are planned according to basic body constitution, that is, prakriti of a person, and are always tailor-made, that is, different treatments for different people. Hence, treatments are to be taken under the supervision of a specialized doctor only. Ayurveda treats not just the spine, but the entire body beyond and along the spine. Thanks for watching this video. Comment, like, and share this video. Thank you.